Three of the largest hospital groups in Metro Atlanta now require all staff to be vaccinated against COVID. The deadline was last Friday. Emory, Piedmont, and Wellstar won't disclose how many people lost their jobs.
But Fox 5 IT reporter Randy Travis talked to one longtime ER physician who insists he's not an anti-vaxxer.
So you've not been vaccinated?
That's correct.
Dr. Tommy Redwood is no quack. He spent 16 years as medical director of emergency services for Wellstar Kennestone Hospital. 4 more years working in Piedmont Hospital's ER. But last week, this termination letter from Piedmont became official. Redwood failed to follow the hospital's policy that all employees be vaccinated.
We're being denied that opportunity to do what we've been doing all along because we're not willing to get this vaccine.
It's a confusing contradiction. After all, Dr. Redwood has seen his share of COVID patients pour through the Piedmont ER. He's not exactly an anti-vaxxer. He says he's been vaccinated against hepatitis and the flu. But in the past, he has publicly cautioned the use of certain vaccines because he believes there are troubling side effects.
Is COVID just like the flu?
Absolutely not.
Do you think that hospitals are inflating the numbers to make more money?
No, I do not buy that. With this Delta wave, it's like drinking out of a fire hydrant. We've been seeing big numbers.
And he stresses almost all the COVID patients he's had to admit are unvaccinated.
Can you see it from the hospital's perspective? They're, as you said, dealing with a fire hose of problems with unvaccinated patients, and they've got a doctor who refuses to be vaccinated.
I think what the hospital should be doing is actually the same thing they were doing when this pandemic first started, which is to support anybody willing to risk their life to come in and to provide care for patients who are needing help.
If the numbers are showing that unvaccinated people are appearing in your hospital far more than the vaccinated ones, what's the problem with vaccines? I'm
not here to say that I'm against vaccines. Okay, that's one thing I want to make perfectly clear. Nowhere have I ever said don't get the vaccine. Building this barn for the last 5 years, I think.
Just not for him. At 63 and fit, Redwood believes he's far less likely to get seriously ill from COVID because he has no comorbidities like most of the patients he's seen. He also says he wears a mask outside the house, although not everywhere, doesn't shake hands or get too close to others.
When I'm at the hospital, I wear a mask in front of every patient encounter the entire time I'm in the hospital.
Do your patients know you're not vaccinated?
That's not something I share, no.
Why? And do you think maybe they would want to know that?
If they want to know, they're free to ask. A lot of the patients I see, you've got to remember, are coming in because they haven't been vaccinated.
They're like you.
They're like me.
And for him, the risk of any possible unknown side effects from the COVID shot outweighs any proven benefit, especially now that the vaccines require boosters.
So you think in your personal situation, getting the virus is less dangerous than getting the vaccine?
No, what I'm saying is I don't want to get either one.
Life-threatening complications are very rare. In my own practice, I have admitted a number of children to the hospital with COVID-19 and COVID-19 complications. I have yet to admit a patient to the hospital with a serious vaccine side effect.
Dr. Cameron Sultan is a pediatric ER doctor and the secretary-treasurer of the Georgia College of Emergency Physicians. Redwood is one of their members. The group endorses vaccine mandates for healthcare workers because it means an additional layer of protection for both them and the patient.
You know, if that is Piedmont's policy, then I think it should be followed.
Piedmont Healthcare had no comment about Redwood's firing or whether the mandate has affected already difficult staffing levels, only calling employee loss minimal. Redwood said he offered to be tested weekly but got no response. He says he's only taken one COVID test so far and it was negative. The FDA says all 3 vaccines are safe, effective, and proving to be the difference maker in saving lives.
That vaccine is keeping people from getting severe disease. I will agree with that. It's too soon to know what long-term implications this vaccine could have.
When will we know whether you're wrong or you were right?
I don't know the answer to that.
Perhaps once the list of possible side effects reported by the public is fully investigated, rather than immediately used to push the anti-vax agenda. So far, nearly 2/3 of our country, 215 million Americans, have received at least one shot.
You're getting it all.
Redwood won't be stuck at home for long. He's already landed another job, practicing emergency medicine in Alabama at a hospital without a vaccine mandate.
The people there seem to appreciate me when I'm there. They're not asking me about my vaccine status. They know I'm there to help them. They know I'm wearing a mask, and they welcome my presence.
As he welcomes the opportunity to continue being a doctor somewhere else. In Fayette County, Randy Travis, Fox 5 News.